Today, I'll talk about contextual user experience and give an illustration of how you can apply this in a low resource setting. Before we start, I'll give you a little background about my journey. So I'm from Kenya, and I grew up there. So most of my work is, when I speak about low resource settings, I'm referring to research that I did in Kenya as a graduate student and a Ph.D. student. So after that, I joined IBM, where I conducted human-computer interaction research for the first 6 years. And the work that I did revolved around healthcare, financial inclusion, farming, and family communication routines. And most of this work focused on capturing the cultural, social practices in these local communities, middle income and low income mostly, and then providing design recommendations of how technology could be designed to take advantage of pervasive technology that existed, more so with the intention of modifying what already existed as opposed to creating new technology solutions. So within IBM, I then switched from Nairobi, where I was based in IBM Research Africa, and then I worked with teams in Yorktown and Japan on HCI for AI. So on that, we worked on IBM's automated machine learning tools. We worked on visualization of model creation using these tools, and also trustworthiness of AI systems. So I did that for a while, and then the last 2 years at IBM, I moved into UX and product, and for that, I worked on IBM Cloud products. And then this year, I switched into research consulting. So in market research, I found that there was a different approach to how UX was conducted. So at IBM, for instance, we focused on product and worked with product teams. And then when we started doing the social practice, studying in low resource settings, so that was in Kenya, we focused on understanding communities to inform the design of technology. But now in market research, we were focusing on creating business opportunities while staying there to keep working. By keeping working, I meant taking the design processes that I'll talk about here from one stage to the other, as opposed to just conducting UX for a specific product and stopping there. So how did we come to this term contextual UX? So like I mentioned up here, it's an evolving definition. I started thinking about it when I switched from product research at IBM and moved into market research. So the first time I came in contact with this term was when I was writing my dissertation, and I was reading Karen Holblatt's work, where she defined contextual design as a user-centered approach that used in-depth ethnographic research rooted in contextual inquiry, and then the data collected would be analyzed, and this would ideate how the process of design would pick up. So based on that understanding of context, and also having worked in different contexts, so the rural communities, the product context at IBM, and now market research in the industry, I thought of another way of expressing a UX process that captured all these aspects of my experience. Now, the UX, the Interaction Design Foundation defines UX as a systematic study of targeted users and their requirements to add context and insights to the design processes through various means and to uncover problems and design opportunities. So for us, the starting point of our definition is I'm saying contextual UX to be a framework that seeks to understand the social practices of a user based on their context, and using that to inform the design of personalized and immersive experiences. So in the case of my experience, is more around digital solutions. Overall, the overall UX approach focuses on improving the digital experience of users, but more so, you work with different sets of teams. So you work with stakeholders. Within stakeholders, you have users. You also have people who own the products, and then you have people who build the products. So as you capture a process or a problem that you want to understand, you get input from these three sets of users on what approach or what goals they need to be met. And then you conduct a research method. So some activities that you conduct to help answer these questions are desktop research, design thinking, contextual interviews. And then for products that are already in market and you want to monitor their performance, you conduct heuristic and maturity assessments. Now, once you do that, you also provide deliverables back to the stakeholders. And this could be prototypes, or they could be reports, and there could be also recommendations on which ways to improve the product. So that is the standard way of applying UX to solve user problems. So now what we have here is nothing different than what you've seen before. We have 5 steps of areas that we perceive UX could help improve. But the reason why we are drawing this in a circular way is because, like I mentioned, when I joined market research and started conducting UX, the goal is to first democratize user experience research. And then the other one is to, depending on what parts of this circle you engage with your clients, another goal is to also show them other aspects of how you can improve their solutions. So we'll take an example. So first, at IBM, we worked on specific parts of this circle that you see here. So for instance, we worked on products. So we would test the product, conduct user interviews, solve a user problem, work with stakeholders, and then provide feedback. But in industry research, when you get a concept from a client, you address the problem, but the other intention is to show them how you can move this work to the next step, which is design. It doesn't have to go through the circular part, but depending on the budget and the interest of your client, the idea is to show them how this all puts together. So that's why we have the circular part. And generally, to the right, when you're conceiving the concept, doing the design, it's more of interaction, and you want to show what could be provided. There are methods that are particular to help solve that problem. And then to the right is more of existing products that need to be improved. So in terms of personalization, what we mean here is that several people can come to a website, for instance, but depending on their role, all of them would have different goals. So that also calls into practice. They need to understand the users, define personas, but those are standard UX methods. But what is interesting is that as you build that, sometimes you also need concepts to improve the performance of personalization. So that is why we have a circular diagram. So now we want to take that concept that I just shared with you and apply it and show how it could be applied in a low resource setting. And to do that, I'm going to talk about one of the projects that I conducted while I was at IBM. So first, how do you even identify projects for scaling in a low resource setting environment? So there's several ways that this is done, and most of this is in research. You can look for unsolved problems that are in the market. A lot of work has been done in fintech, especially in Africa. You can also look at other solutions that were implemented earlier. So in the area of healthcare, we had, before the advent of video communication, we had telephone systems that hospitals could use to communicate with patients. So for instance, there was a system in India where messages could be sent to women who were pregnant. So those technologies that were designed before the advent of this wide use of videos could be iterated. And also you could pick up research recommendations from published work, such as in the area of healthcare. So what we're going to focus on is actually work that we did that focused on healthcare, but we moved it from research into a business product. So what you see here is a health facility, it's a rural health facility in Kenya, and they were interested in understanding how technology could be used to solve challenges in the area of hypertension management. But the title, this is a research publication that we conducted, and you can see that we looked to explore the rural community practices in HIV management for the design of technology for hypertensive patients living with HIV. So what this meant was this facility had undergone a very successful process where they used technology to monitor HIV within the community. And the country as a whole also had an electronic HIV management system that we learned from. But we focused on this local community because in addition to using the technology, they were interested in following up with the patients once they went out into the village. So that is where we started, and we conducted this study, but it stopped after the institution. So that was IBM and the health facility. Once we finished the research and then we presented the results, the project never moved into actual implementation. And that is one challenge that we have in low rural income settings or developing countries, that is called. The problem is that when these research problems are initiated, we go to the community, we tell them we are here to learn about challenges that you're experiencing. We're going to design technology and come back. But this facility was in my village, so even when it stopped, I still go back there. So I had a connection with it. So we pushed it forward. And then, so what I'm showing here, I've skipped several steps, but I'm showing that we iterated it into technology solutions. So this is the interface of our MVP. And what you can see is we have in the middle of this diagram, you can monitor visits of patients, capture trends, and then to the right at the bottom, you can see that we can also sync some devices. So what we're doing here is we are digitizing reports for patients, and then these reports could be shared and also trends can be captured. So that solved one of the problems that we found in our research, where most of the treatments in hypertension were conducted on paper records, and when people moved from one facility to another, these records would disappear. And also we integrated other parts of this, other solutions to this MVP of ours. And another one is patients are able today to make appointments remotely via chat interface, among other things. So I'm just giving an highlight of how the project moved from research into a business product. But lessons that we learned were, one, we needed to support the role of community health volunteers. And these are people who are more connected to patients because they went to the village than at the facility where you go and see the doctor for about 30 minutes. They give you instructions and you go to the village. And then patient data was addressed in that we are digitizing records that would disappear. And over time, people who have chronic illnesses face challenges when they can't access these records. And then third, appropriation of technology. This, we wanted to have a solution that people could access using cell phones, that they were already pervasive in these communities. The key point and one challenge that is faced when you work on such projects, this is just one, but like I mentioned, we've done several projects in healthcare, in farming, in water. We face the same challenge. And then one of the challenges that I think should be highlighted is that these projects eventually, we write research papers that people don't end up reading in the village. So change in strategy, this happens, like community institutions will set up these projects, and then once focus shifts, they do that. But this shift in strategy and then some recommendations don't end up being implemented because they're expensive is a big challenge, because when you go back to the community, usually it's a big problem when you start new research projects and 3 people have done research projects before you. The communities always look at you as if you are here just to meet your selfish goals. So now that is a big challenge that I mentioned, but we'll switch back to our project, which I mentioned. So we moved it from a research recommendation to an MVP. So an MVP is a product already that you can share. So I think one of the ways we can approach addressing the challenges of having research that is incomplete is to think about ways through which we can access these projects, build MVPs, engage communities, share information that helps people get to the building of technologies or picking of projects through opportunities that exist. So the opportunities are what I'm going to talk about now. So the first one is we can leverage technology training and focus on current trends to see how we can move projects that I think are staying at a point where we conduct a lot of research, we provide a lot of recommendations, and they remain sitting there. So one would be to offer training based on available free learning material. So what comes to mind here is Y Combinator training. They provide free learning materials on business models, pricing, startup funding, or even launching MVPs. In addition, you might also be lucky to get funding, but the information that we provide, I think, is very valuable. So that means if this information can be curated in some way and shared with people in low resource settings, especially people who are interested in those topics, that would be a very good way of sharing knowledge to people who can use it. And then we also want to capitalize on new learning avenues. So recently, especially after the experience that we had with COVID, there's a lot of information that is available on online forums. And for example, now, once you have a product such as an MVP, there are trainings that can teach you on how to design highlighting web pages for products, how to build brands, how to spot opportunities in social media such as Facebook groups, competitor challenges, and understand how you can conduct negotiation skills. What I'm saying is there's a lot of information that is available, but there's need to curate it in a way that it could be meaningful, especially for people in low resource settings where this technology might be moving so fast that they don't even see it or don't have access to it. The third one is to apply AI tools to automate activities. So this will not solve all problems, but this helps you understand what is going on in the field. And you can see there's tools such as SimilarWeb. So this is a software that you can install in you can install it in your Chrome browser. It's an add-on, and then you can monitor people who visit your competitor websites, and you can even see the comments they're making, follow up, and then comment on these groups. That way, you also get traction because you can just go to a group where there's a problem and you can mention, oh, try this other product, it's also solving that problem. So there's simple things like those ones. But still, we won't underestimate the need to have some knowledge to be able to implement this. But the point here is there are opportunities that could be explored to bridge the gap that has been necessitated over time with digital divide. So the topic of digital divide, the way we think about it, that those people in low resource settings would need to catch up with these people in developed side of the world. I think we can, once you have an MVP, the rest of it is a bit of marketing and understanding other aspects of product development. That information is available somewhere. But I think what is missing is a way to curate it so that the right people meet, get this information and learn what they need to learn so that they're able to scale their products. So what are we proposing? So we are highlighting three areas where I think we could start from. So the first one, we're we're proposing that if we provide basis of research that addresses key areas such as healthcare, water, natural resources, and financial inclusion, these are topics that are very hot in developing areas. I think we have a lot of publications that already exist in this area. So if there was a way that we could look at work that is sitting, their recommendations have not been implemented, that work, it would be good to bring it up in some ways. Again, it's training or looking for ways to take this information and make it usable to the local communities. Like I said, we don't have a strong culture in low resource settings where communities go to read research papers of the findings. The other part is UX research, and also refer to this as human-computer interaction, just because the products, the recommendations that we provided in most of the work that I mentioned were design guidelines. So those design guidelines, without interpretation or implementation, they will just remain there. So I think we also want to look at today, like I mentioned, there's a lot of tools that are coming up. The AI is advancing. And over time, the approach to UX is for us. I think we can, we can go there, teach people about how they can use user testing to conduct user research, but we also need products that solve our problems and then conduct research on those ones. But there's ready-made products that exist. So there's products that can help you with capturing clients who come to your website, monitoring what they do, and even collect payments. So figuring out how to connect what we have and what already exists can solve a huge problem. So then you don't have to employ a lot of people to do these other parts to build a complete product on your own. And then finally, integrating UX solutions to have a complete flow. I think this is also a very good opportunity because we have social media that people are now engaging in. It's easier to market your products in these ways. Not easy in terms of doing, but I mean in terms of opportunity that are available. And traditionally, some of these processes required large teams for implementation. So one thing that I've liked over the last 2 years is I've been following the Shopify shop creation. I think there's a lot of automated parts of it that show that there's a big potential if you can move an MVP product or move a solution that someone has. There's a lot of integrations that you can add, help you with payments, help you with putting your website online, help you with marketing, and all these things, you can learn them. But I think the challenge still remains is which way can this be provided so that it's useful to people who are in low resource settings. And that brings us to the end of the talk.
Great. Thank you very much, Eric. Thought that was a really interesting talk and kind of hit on some of the challenges that I guess are a bit unique to the low resource setting, but also very familiar. And that brings me to kind of my first question. You hit on the point of all the research gets done, but then often it just languishes there and it doesn't get implemented. So when I was looking at your solutions, it was kind of, well, how can people still get access to that research and all of those research papers that have been written and all of that information? But how do we solve the problem of that's still there, of that gap of getting it implemented without relying on just having the good luck to have you in the village to build the MVP?
So I think uh, my view of how this could be done is someone has to do the heavy lifting in the beginning. So by heavy lifting, what I mean is um, what I mean by heavy lifting is I was part of a project. I have better understanding of the overall view. I initiated the project. I've worked with these people in different countries and saying that information, you have to get it just through the way that I did. But I think I have a bigger role now to simplify this information in a way that people can use it. So it's not work that somebody else will do. It's work that we will set communities just the same way UX DX is set up. Like someone had to do work to bring a community together. So we need to do that. I think we need to collect with people who are building this, who are doing research, and we need a different way of presenting research to people in low resource settings. They still need to know how they can play part. Otherwise, if we don't do that, I don't have a solution, but I think we need a community to think about ways through which we can present this research. Otherwise, it looks like you came, conducted studies, and left, and we'll continue with our work. So it's a process, but the first part of it is to form a community that will approach this solution.
Great, great. And look, we had a quick chat beforehand. I'm quite bullish on AI and where it's going to go to over the next few years, just with what we've seen with GitHub Copilot and others this year, that I'm hopeful that over time it'll actually become a lot easier to build the software. But the challenge is actually going to be in the research and making sure that we ask the computers to build the right thing. So it's really interesting. I think your way of trying to bring all of that research up is going to be incredibly valuable then.
Yeah, and then like I said earlier, I think that's a big opportunity, and AI also provides it kind of provides a shortcut, but also it's a challenge. So a shortcut in terms of when there's parts of automation, but also are we going to be able to bring our communities to a level where they can input this automation, input information for this to support this automation? Because as you understand, AI also depends with the data that it's fed. So that means, yeah, I think that means for people like me or people who are interested in advancing this work in developing settings, we need to quickly think of ways of coming together and thinking through it. But nobody else is going to do it. So I think it's just us, and then communities that we build, people who are interested, and then we'll make some steps. We might not solve all the problems, but we can make the first two steps to lead towards solving the problem. So I agree with you.
Excellent. Well, I think that brings us to time. So I think it was really interesting talk. But as I said, I think people are seeing that same problem, whether it's in a low resource setting or in high resource settings, where all this research gets done and yet it isn't being implemented enough. So I think some great ideas there on how to solve it and bubble up the research in the right way. So I hope that's useful for everybody out there who's watching. But I just want to thank you, Eric, for sharing today.
Yeah, thank you, Maiden. Thank you.
Thanks.